Hello, I'm Annette Young and welcome to the 51%, a show about women reshaping our world. Coming up, they're known as the foot soldiers of India's healthcare system, the female health workers saving thousands of lives in Indian rural areas are now demanding better pay and recognition from the government. Also, a move by the French government to improve the level of maths in schools backfires, leading to a significant percentage of girls dropping out. And the stigma of periods means many teenage girls stay away from schools in the African country of Guinea as they face shame along with a lack of access to sanitary products. But we begin in India, where more than 1 million female healthcare workers, known as ASHA or Hope in Hindi, work tirelessly to help the country's poor. In the last 16 years, these women have become the backbone of the country's healthcare system, especially for the hundreds of millions of Indians who live in the rural areas. Now they're fighting for better pay and recognition from the government, as our team on the ground report.
Every day, this group of women goes from one slum to the other in South Delhi. Even extreme heat can't keep them from their work. They are called ASHA, short for Accredited Social Health Activist, which also means hope in Hindi. Today, an army of over 1 million ASHAs takes care of the health of underprivileged communities.
We've been assigned an area of 400 houses. It has a population of 2,000. We take care of these people, including pregnant women and senior citizens. We do a daily survey in these communities.
Neither doctors nor nurses, this all-women group is the first point of contact for medical care for the poor.
3 kilos.
Launched in 2006, the program aims to make healthcare accessible to India's rural population. Ashas are recruited from local communities and undergo extensive training. They were brought in mainly to curb infant and maternal mortality rates.
The commonest problems are about women being pregnant, being unable to access antenatal care, about newborn children with maybe diarrhea or fever, where the health facility is very far off. So therefore, the idea that ASHA could provide and be sufficiently trained to provide these services was the beginning of inclusion of ASHA in a health system.
India faces an acute shortage of doctors in rural areas where 65% of its population lives, yet employs only 30% of its healthcare workers. On top of that, 2 out of 3 doctors in India don't have any diploma or formal training in medicine. The situation is even worse in the countryside. 1,500 kilometers southeast of New Delhi lies Odisha, one of the poorest states in the country. Mathilda Kullu, an ASHA worker for 16 years, belongs to the first batch of recruits. She helps over 1,000 families in this area. As part of Mathilda's duties, she makes sure sick people follow their prescribed medication. This morning, she's here to check on this man suffering from leprosy.
Show me, has the swelling decreased now?
I've been told to take my medicine for a year.
Yes, for a year, and don't even stop it for a single day. He's better now. It's his first month on medicine. I'm here to ensure he's taking it the right way. If he makes any mistakes, then I have to advise him. I also told him not to drink alcohol, otherwise the medicine won't be effective.
Mathilda is a lifeline to the villagers, but winning their trust was not an easy journey.
They didn't know about the facilities available in hospitals and why they should go there. They used to say, I want to give birth at home, but now hospitals account for 100% of all deliveries. Earlier, people were misinformed and they self-medicated, but that's stopped. Now they visit the hospital and only after checkups, they take their medicine. Also, ASHA workers have to be mindful of how to talk to people of other castes. Sometimes people say, don't sit close to me, to lower caste ASHA workers. They're very casteist.
Over the years, the duties of ASHA workers have been expanded to include family planning, eradication of polio and tuberculosis, and immunization campaigns. And when the pandemic hit, they were at the forefront.
We'll arrange the vaccination here, so do come.
When do we have to take the booster dose? After 9 months?
Yes, 9 months after the second dose.
But now, Mathilda and thousands of her colleagues are fighting another battle. For months, they have been protesting against their low wage and employment status. According to the Indian government, they are volunteers, so they get only a small compensation. They are paid between 40 and 100 euros a month depending on the state.
During the corona period, all of us were applauded. The government said we did remarkable work. People were asked to clap for us. We were given flowers and garlands. But that's not enough. We have families to feed. We deserve a minimum wage. We should be recognized as workers. We should be enrolled in the pension program and have social security.
Their hard work was honored by the WHO in May with the Global Health Leaders Awards. A long overdue recognition for these women who are caring for millions of poor people.
Here in France, the Macron government has attempted to reform the national high school curriculum. In order to improve the level of student maths, education officials created elite classes. However, students were also allowed to drop maths entirely, and to the horror of the government, nearly half of the girls have done just that. Shirley Sitbon has more.
These pupils were taken on a school trip to learn more about technology and the world of industry, an opportunity to tell them those fields have nothing to do with gender.
Some people may think these jobs are for boys, but the truth is that anyone can have the careers we've seen here.
Only 30% of those who work in manufacturing activities are women. The gender-based distaste for the industry and science in general starts at an early age. Many girls think it just isn't for them.
They don't believe in themselves. That's why there aren't many girls in science. They have to be more confident, and no one should tell them, don't do this job.
Stereotypes seem to be at the heart of the problem. Even some teachers pass them on to their students, often involuntarily.
Sometimes teachers call on boys to solve math problems because they think it will be easier for them than for the girls, and that boys are more likely to give the right answer. But studies show that that's completely wrong.
Experiments show many girls internalize those stereotypes. When asked to draw this geometric shape as a math exercise, girls underperform. When asked to do the same as an art project, they do better than the boys.
During an evaluation, when something is at stake in a difficult maths test, for example, these negative gender stereotypes that say women are allegedly not as good in maths can become a handicap. These clichés throw them off and block some of their cognitive capacities, so they're not able to use them to the fullest to resolve the task at hand.
The gap between boys and girls has worsened with Emmanuel Macron's high school reform. Before the reform, 44% of female students chose advanced math. The following year, only 24%. Women working in science and manufacturing have started meeting with female students to deconstruct stereotypes and show them they can do anything they want.
Now, according to UNICEF, more than 60% of teenage girls across the world are not properly educated about menstruation. It's particularly acute in the African country of Guinea, where many girls don't go to school during their periods. This is because of the pain, stigma and lack of sanitary products. Our correspondent sent us this report.
Fatou is a 17-year-old high school student. She's going over French revision at home to avoid falling behind. During her period, she rarely goes to school.
When I have my period, I go 4 or 5 days without going to school. I have cramps, I'm in pain, and sometimes I feel like vomiting. That's why I don't go to school. On top of this, when I do go, I'm afraid that my friends would tease me, especially the boys.
Young women in Guinea struggle with a lack of information around menstrual hygiene. Thousands of teenagers in the country are victims of what some term period poverty. Aisha is trying to break the silence around this taboo subject.
Don't be disturbed. We are all friends here. Tell us what you know about the menstrual cycle.
She aims to better inform young people about menstrual hygiene. No question is off limits.
I saw a girl in the room. Her clothes were completely soaked.
It's not taught in schools or at home. There is total ignorance here in Guinea. We decided to get involved and unite to better educate the youth about menstrual hygiene so that they know what it is and how they can deal with periods.
The situation is even more difficult for women in rural areas. Guinean NGOs say that more than half of women simply use rags because sanitary pads and tampons are too expensive.
And that's all for now. You can keep up with the 51% on Facebook, Instagram or Twitter. Plus, you can catch our previous programmes on the France 24 website. So until our next show, bye for now.